Hello, welcome to my channel. My name is Dominique Latrice, in case you have never seen my face before. And today I've been undergoing weight loss surgery for over a year now. Went through the whole program. I've been suffering from being overweight most of my life since I was a kid, preteen. And I just got tired of it. Like, it got to a point where I began to develop underlying health issues, high blood pressure, being pre-diabetic, joint pain, sleep apnea. Like, I have a lot of underlying issues, and I'm very young. I'm only 31 years old. So I made a choice to really do something about it, and I just continuously nag and complain and just sit around and do nothing. I wanted to do something about it. So I spoke with my doctor, and she recommended me to get weight loss surgery. So I entered into the program to get weight loss surgery. I went through my insurance wanted me to go through 6 months of getting clearances and being monitored every month, losing weight or maintaining my weight for 6 months. I went through the whole 6 months. When I get to the 6 month, I go to my pre-op class, everything. They tell me my surgeon does not accept my insurance. Even though I fact checked and did everything I supposed to have done, the whole nine. Anyway, after that nightmare, COVID happens, a bigger bitch nightmare. So now I'm back at it again. I'm at a different hospital. I changed insurance plans. Now I live in Michigan, and I'm currently undergoing weight loss surgery at Henry Ford West Bloomfield. Prior, I was at Beaumont Hospital, and it was just not the best experience whatsoever. I just honestly feel like they just did not have enough things in order. They were just simply not taking care of business. So when I switched over to Henry Ford, I felt like it was God sent. I felt like it was just meant. Like, all of this was meant for me to be here, because the experience that I've been having with Henry Ford Hospital is just amazing. My surgeon, the staff, the dietitians, everyone, nurses, everyone is just so professional and thorough and just amazing. My process has went so smoothly. So I finally got my surgery date. So I spoke with the surgeon, and prior to me getting my surgery date, he wanted me to lose 10 pounds. I'm currently, at that time, I was 298. And then after, and so in August, I was 298. And then I ended up gaining some weight. I gained 10 pounds. And I met with my dietitian the end of August. And he told me my surgeon wanted me to lose 10 pounds before surgery. So I started dieting. I started walking a lot. I dropped 12 pounds. And when I went to go, I dropped 12 pounds. So that put me back at the starting weight that I was at, that he wanted me to lose the 10 pounds from. So now I'm back at 298, and my surgeon the last time he wanted me to he wants me to get to 288. So I had an appointment, and I met with my dietitian, and he said I still have to get to that 288. So when I went back to him, I just went to him yesterday, and I lost 3 more pounds. So I have a couple more pounds to go, but I'm beyond confident that I can do it. Like, it's hard work changing your mindset, changing your habits, being more active. But when you really want something, when you really want to make a change, when you just so fucking tired of just doing the same old thing and it's not working out, it's just time to change it up. So I've been incorporating a lot more activities. I've been playing soccer with my daughter, playing basketball with my daughter, and my husband. My husband has been so amazing during this process. He's been really staying on me, helping me. I just been eating a lot better. I've been training my body, like getting my body ready to have surgery, to undergo, because this is serious. So the surgery that I'm planning on getting, if you have not heard of it, is gastric bypass surgery. And well, gastric bypass and also VSG, vertical sleeve gastronomy. Now, I don't know which one I'm going to get due to the fact that I have extreme acid reflux. And if you don't know, if you have severe acid reflux, they don't recommend you to get the sleeve. They recommend you to get the gastric bypass. And this surgeon told me, well, when I first went to him, he said he wanted to do an EGD on me. I believe I'm saying it correct. An EGD, where they put the scope down your throat. They give you some anesthesia. They put a camera scope down your throat, and it's basically just to check your stomach out, to check your esophagus, to make sure to see if you have a hernia or ulcers or bleeding ulcers or just something going on in the stomach. So I went to do that. It wasn't bad at all. I went to do that and they didn't find anything wrong. My surgeon said, due to the fact that they didn't find anything, he's kind of on the fence to do the gastric bypass. But he said it's a possibility that during surgery, even though during the EGD that he did not see a hernia, it's a possibility that it can still be one there, hidden under some fat or something. So me and him talked for a while the other day, and we came up with, okay, if I undergo surgery and he see a hernia, he's going to repair it and then do the sleeve, because they say acid reflux can usually come from someone having a hernia, and the hernia pushes up in their stomach and causes acid. So he said if he sees the hernia, he's going to repair it and do the sleeve, the VSG surgery. But he said if he does not see a hernia, he's going to go on ahead and do the gastric bypass, because therefore he doesn't want my acid reflux to get worse after a sleeve, because studies have shown that people acid reflux gets worse after getting the sleeve, and I just can't go through that. My acid reflux is already a pain in the ass. So me and him decided if he sees the hernia, he's going to repair it, and I'm going to go for it with the sleeve. If not, I'm going to go for it with the gastric bypass. The difference between the sleeve and the bypass is the sleeve, they cut the stomach like a banana. And basically you just they cut 80% of the stomach and you're left with that. But the bypass, they make a pouch and they cut 80% of the stomach, but they reroute the small intestines. So that's why it's called bypass, because the intestines is bypassing other intestines going into the smaller pouch. It's a little bit more invasive, but both surgeries are very invasive and it's serious. So it is a lot scary to undergo weight loss surgery, and especially bypass. But I just look at it as though I want to be healthy. I want to see my grandkids. I want to be more physical with my daughter that I have now. When my daughter gets older and have kids, I want to be able to be there for her. I want to be alive. I want to take care of my grandkids. I want to have more kids of my own. I want to be healthy. I just all around want to be healthy. I want to feel good. And of course I want to look good, but for the most part, I want to feel good. I really want to feel good. And I'm just so happy. My surgery date is October 26th, and I start my pre-op diet October the 19th, a full liquid diet for 1 week. Ooh, I'm not excited about that, but you got to do what you got to do. Yeah, if anyone is undergoing this surgery, already went through this surgery, please leave a comment down below. Let me know something. Like, I haven't undergone my surgery yet, and I'm pretty sure if you already experienced this, you can teach me a lot, show me a lot, tell me a lot. So I'm very open to receiving information from anyone. But this is a journey that I definitely want to capture on YouTube. I want to take you guys along. I'll be taking you guys through this process, the ups, the downs, the crazy. This is just very exciting. I feel like 2020 has just been an eye-opener year with everything going on with COVID and everything. It's just making a lot of people reevaluate their life, their relationships, the shitty parts about their life and personality. It's just truly, honestly making you want to reevaluate and just become a better person. And that's what this year has truly shown me. It has showed me to show gratification for all the things that I have, and it showed me to get resilience and work towards the things that I don't have, because today is not promised. I mean, we always knew that, but going through this COVID stuff, it's like really showing you how to truly appreciate life, because I feel like Americans, we have truly took life for granted. Like, we have just taken it for granted. And this year has really, really strengthened me, has grown me. It's opened my eyes to the world. It's opened my eyes to this fucked up country that we're in. But to say, basically, to sum it all up, I'm just excited for this new journey. I'm excited to go on this journey, and I'm excited to take you guys along with me. So yesterday I went to my pre-op class, and they basically told me step by step about the surgery, the pre-op diet, the diet that I have to be on the week prior to surgery. They told me about the diet that I have to be on the second week and the third week. I believe I'm going to be on the first pre-op diet is full liquid diet. The second week, the week after surgery, I have to be on a clear liquid diet. And the third week after that, I believe I'm on soft food and then puree, soft foods. And then I believe that's it. But the full pre-op diet, it consists of protein, meal replacement proteins, Gatorades, sugar-free popsicles, water, Crystal Light drinks. What am I forgetting? I think I said broth. And that's about it. That's all I can have for a week. So that's going to be very annoying and challenging, but I have to do it. The point of doing the pre-op diet is so you can shrink your liver. So when they go in and do the surgery, your liver isn't huge and it's not in the way. So it's basically to starve the liver, to shrink it, to make the surgeon job easier and make it safe for the patient. So it's very important to do that. So that's what I have to do. So when I went to the pre-op class, they showed me everything about that. They even gave me a bag full of some goodies and things that I should do prior surgery. Let me show you what came in the bag. So this is the bag. You can see it. This is the bag. And in the bag, the first thing I got is this thing right here. If you can see it. And this is like a respiratory exercise thingamajig. So you basically breathe into this slowly and you watch the meter go up, and it's to strengthen your lungs. They say this helps strengthen your lung for surgery, because a lot of people is prone to getting pneumonia after surgery. So the more you strengthen your lungs, the less likely you will get pneumonia. So they told me to do this every day for like 10 to 15 minutes every day to strengthen my lungs. And keep in mind, I did not get this at the last pre-op class I was at. Like, this hospital is truly, truly God sent. Like, they truly, truly care about the patients and not just collect the insurance money. Okay. They also gave me this, what is this? They gave me this alcohol-free mouthwash. They gave me 2 of these to take the night before and the morning of surgery. And they also gave me this sponge to wash up and take a shower with the night before and the morning of. And it's solution in this sponge. You wet it and solution comes out, and it's to clean your body and to get all the bacteria off. It's basically like just a disinfectant type of antibacteria soap to scrub your stomach where they're going to do the surgery, your whole body, head to toe. So they gave me 2 of these, and yeah, the respirator thing, and then just the mouthwash. So that's what came inside the pre-op bag. Don't forget to hit that subscribe. Come on this journey with me. Thank you so much and see you on the next one. Bye.